Hey everyone, my name's Mia. Welcome to the podcast. It's World Immunisation Week, and today I speak with two health professionals at NRCH, a GP and the coordinator of the Multicultural Health and Support Service. It has been a great listening experience for me to hear them compare their own experiences working in our diverse community to advocate for vaccine equity and health equity in general. They also discuss the collective actions needed to create a successful health promotion and immunisation campaign for diverse communities, and ultimately how immunisation has reduced vaccine-preventable diseases in Australia. So without further ado, let's do it.
I'm Gloria Moscattini, a GP at North Richmond Community Health.
My name is Pierre Moro. I'm the current role here that I've got is as coordinator of the Multicultural Health Support Service, and we work with communities and service providers around sexual health and multicultural communities.
The theme for World Immunisation Week is Long Life for All. We know that people from migrant and refugee backgrounds all deserve to get immunised, just like everyone else, but this requires greater efforts. What are the challenges that we're facing in reaching this goal?
My experience has been that working with refugees, that there's a lack of documentation to back up what they've had either in their own country, in camps, refugee camps, or when they've arrived in Australia. There doesn't seem to be one easy process of identifying what they might have had so that we can then plan what's missing or what they need. And that's often quite challenging for them if they've become Australian residents, family payments are tied to who's had vaccinations and who hasn't. So that becomes a challenge for families from that regard, a financial point of view, but also in terms of what protection they have against any of the community infections that may crop up from time to time. And that's certainly something that we're finding. Things like chickenpox and measles are found in new arrival communities, and that's partly because either they haven't been vaccinated before or we've missed out in vaccinating them when they've arrived because we didn't know what they'd had.
That's right. And, generally speaking, with the migration patterns, people also forget. They might even think they've had certain vaccinations. They never have, so they wouldn't even go to a health service and say, what do I have? If you just asked very briefly, people would go, oh, yeah, chickenpox. Yeah, I had all the childhood vaccinations, but maybe didn't get all of them.
Yeah.
So there needs to be engagement by the health providers to actually do a bit more probing to see have you actually got all of them, or how many have you got? Because people sort of forget. And also with some people, especially if they've got from poorer backgrounds, their initial years in Australia might be about just getting stabilised, getting and settled, and they might not even think about vaccines for them or for their kids. So again, it just takes. We always have to think that our services need to make sure they have some kind of outreach, some kind of engagement with people, and to try to get more of their story. Otherwise, if we ask very simple, quick questions, the likelihood we're going to get very simple answers which may not be totally correct.
Yes, yeah. And certainly most of the people who come as refugees don't have the documentation to back up what may or may not have been given to them. It's the last thing they're thinking of. Yeah.
What is the process for new arrivals to get immunised? Do they take a blood test to see?
They can. It a little bit depends on how they come to Australia. So there are a range of processes. If they're under family reunion, it seems to be different to asylum seekers. There's different standards of vaccination proof that is needed for those different categories. Also, who pays for those vaccines once they come here if they haven't had them, or to have them in their own country is an issue because they're not necessarily cheap vaccines. So often for some of these, it's just as easy to get blood tests done to see what level of antibodies people have. But that requires them to have already engaged in with a GP for a checkup that's not around being sick. We need to have some process where we can perhaps be proactive and checking on immunisation status separate to that medical model of you go to the doctor when you're sick.
We were talking earlier about translation issues, and I know that in order to deliver the best healthcare possible, we can't be hindered by language barriers or cultural barriers. So a very literal example is if there is a translation error for you as a doctor, that could result in a very dangerous outcome for the patient.
Yes.
And there's also more subtle cultural barriers that prevent us from giving the best care. So I think that's where cultural competence comes in. So what does cultural competence look like in the healthcare field?
For me, it's absolute insistence on having an appropriately trained interpreter of the right gender present in the room with me when I'm doing my assessment, taking a history and clinical examination. And as far as I'm concerned, unless it's an emergency, I will often reschedule appointments until I can have. I do a lot of women's health, and it is so difficult if I have been allocated a male interpreter, either on the phone or on site, to be talking to women of a non-English speaking background about women's health issues, sexual health, contraception. It is a real barrier.
Yeah, look, I totally back that 100%. I think the use of interpreters and the correct use of interpreters as well. I think sometime, obviously, Gloria, you're very experienced, but sometime, not all interpreters are experienced. So you have to realize that, especially when you talk about medical terms, the interpreters themselves might not know exactly what those terms mean. So you need to have that trust and engagement with the interpreter to be able to explore that. But certainly in terms, again, I always say you need the engagement with the people and look at them individually. We still get asked by people outside that would go, oh, how do you work with the Indian community? And you go, well, the Indian community is actually very, very big. You need to actually understand the patient, where they come from, and also their set of health beliefs. I think it's another, because people, as we've seen with COVID-19, may not believe in vaccinations, but even not believing, there might be 10 different reasons why they don't believe. And you can't overcome that if you actually don't know where they're coming from. So that engagement and that understanding. And there are ways you can help that, but I can talk more about those later.
We can go there now. What are the different beliefs around immunisation in different cultures?
For instance, some people might believe in traditional medicine. If you go to the extreme examples, some people believe that vaccines are meant to sterilise populations. Some people reckon there is some kind of colonial type of conspiracy. You can never underestimate the beliefs that people have. One good way for people, and maybe Gloria, you use that yourself, is what we call explanatory models of health, where instead of me, well, I'm not a doctor, but if I was a doctor, instead of saying you're sick or what's your is you actually ask the person what they think their trouble is, and for them to explain what their issues are, because then, first of all, you create better engagement, and secondly, you'll start to find out where they're coming from and what they're believing. If you don't have trust, and I think, again, COVID-19 is perfectly, there's no trust. There's no point of whatever we say. If a person doesn't believe you, they won't.
They're not, whatever you provide, they're not going to follow it. And a really good example of how you might use this building up of trust is around flu vaccines. Now, that's a classic one where so many people say, I had my flu vaccine and then I got sick. You gave me the flu. And this is widespread across a whole lot of different cultural groups and different community groups. And it's really important that we take the time to advise them about what the possible side effects are of having the vaccine, why the benefits outweigh the risks, and indeed that sometimes you do have reactions, but it's not a live vaccine. So this is a really simple example of where we can reassure people that this is going to be more valuable for you because, they're diabetic or high blood pressure or heart disease. And this is really important to protect you. And if you do get cold symptoms next week, it's not because the flu vaccine gave it to you. It's coincidence. But we sometimes don't have the time, or sometimes GPs just don't think of explaining it in that way, which is a shame because then it reinforces that misconception that the vaccine gave them the flu.
And can I just add just on what you just said, Gloria? I think one word that you said is really important, is time. You need to take, and this is a systemic problem with a lot of our healthcare. It's time limited. You go in quick appointments and whatever. When people need time, I mean, even what you've said, it takes time to explain to a person, to hear what they're saying, to listen to what they're saying and put in the words. And maybe they're not going to have the vaccine today, but maybe they'll come back next week.
Yeah, next week. Another good example was when COVID vaccines first became available, we had quite a bit of difficulty engaging the Timorese community. And one of the reasons was that people in Dili who'd had the Sino vaccine, they'd had quite bad reactions, but there had been a couple of people who were reported to have died as a consequence of it. And that spread through the community here, our Timorese community, and it's quite a big community. And it took a lot of time to reassure them. One, it was a different vaccine. Two, it was a very, very rare complication to happen, and that we didn't believe that it was a big risk. And the time that took for the nurses and GPs and receptionists to reassure the community was much more than I expected. But in the end, people really responded to that one-to-one engagement with the health team and the interpreters. It took quite a while. I was surprised.
Yeah, and you mentioned another something that's sort of new is about social media, the internet. We're now, when we're talking about culture, is that communities are often not in bubbles anymore.
No.
So we've heard cases of people getting information from totally different communities in language or, some of the global languages you can call it. So these ideas can now spread horizontally from community to community as well. So we have to really be aware of that and take the time and the engagement process. I remember I was working in another organisation a few years ago, and someone went to see a specialist to ask them about, they were taking herbal extracts, and they were going to go for vaccination, but also some other procedures. And as soon as they went in, the specialist just said, "Oh, and I hope you're not taking any of that herbal rubbish, are you?" Now, that basically obviously stopped the conversation dead. And the person wasn't able to get their questions answered, and maybe just needed 15 minutes for them to say, no, this is all right, this is not, and to talk about it. So that was a negative example of sort of saying, this is the only way, I'm not even going to listen to you.
Yeah.
And I think it does nothing to build
enhance,
it. And then, of course, I would say, Gloria, with the Timorese community here, once you've managed to gain their trust and all that, there's all kinds of forward other positive effects.
Oh, look, it was a very interesting experience where we had to sort of work out where this message was coming from and how we could sort of contain that misinformation and reassure people, and then to start vaccinating them. And then because people were not having dreadful outcomes with it, then the word started to spread. And within a couple of weeks, the queues were at the door to be vaccinated.
And I presume that now that Timorese community trusts this health centre much more.
There's a lot of trust from that community to, with this centre, whether it's dental, medical, social work.
Well, speaking earlier a bit about, you were talking about HPV vaccines. Yes. How do you engage people with culturally and linguistically diverse backgrounds and speaking openly about sexual health?
Yes. The example that comes to mind is one that very recent one where a mother and daughter came in to see me, long-term patients. The daughter's of an age where she's been offered the Gardasil vaccine, which is the HPV vaccine that has been incredibly successful in preventing the development of cervical cancer in the long term for women, and reducing the incidence and transmission of HPV. And the school had sent information home to the family, and the mother was concerned. She was worried that if the daughter had the vaccine, it might encourage promiscuity. Not that she thought her daughter would be promiscuous, but just the concept of preventing a sexually transmitted disease in a community that believes in very strict sexual behaviours in that community. And it was quite a challenge talking with the mother and the daughter and reassuring them that this was safe, it was going to prevent this disease happening, and it protects against a whole range of other types of HPV, not just the ones that are associated with cervical cancer. And it's a slow process. You need to spend time reassuring them that it's been well tested. And in the end, the mum was quite reassured and was going to allow her daughter to have it, which is really important for the broader community. The more people, both girls and boys, who are protected when they are young, the less frequency of HPV being in the wider community and then being able to be spread.
Mm-hmm.
Yeah, look, I think that's a perfect example. And again, in every community, you're going to find slightly different reasons and slightly different hesitancy. And again, if you don't then put it and explain in a way that they understand, then you're not going to get those positive outcomes.
And sexual health is a taboo topic for everyone, but particularly with the cultural barriers that you have existing already. Is it challenging to get people to open up about it?
This is a really interesting question because, yes, some communities are more conservative than others. And, you respect everyone's views. But even within communities, you will then find generational differences or difference between people. So you always have to be aware of that. And you also have to be aware of sometime there will be more vulnerable people in communities, and especially around sexual health. And so, you have to then look at the individual and say, I will give you the best care, or I'll give you the best information. So we always say, always be aware, always of the individual. And also the communities are very different. Like the bigger the community, the bigger differences within the communities, and especially around young people and sexual health. And again, I hate to say, if there's lots of conservative ideas, well, then maybe a lot of things happen underground that you don't know, which does make it more difficult for healthcare workers.
Oh, it does. And indeed, a large part of my work is working with women and their children primarily, not so much men. But this is with the cervical screening, it does sometimes take quite a while for women to develop enough trust to even allow you to examine them, let alone proceed to talk about the sexual part of their life. It's fortunately we've got an opportunity when we're doing things like antenatal care or postnatal care to start talking about these issues with the women.
I might put something else in it, the social context that we know, in communities where there are, so we say, stereotypical norms where, women through health checks come out that have sexually transmitted illnesses of one kind or another. And then, but then their ability to do something about it is very restricted because of their social position.
Yes.
Or the fact that then they'll get into trouble because the partner, husband, will accuse them of being unfaithful and all that, when in reality, it's actually the males who actually are going out there and, especially with some migrant communities that have girlfriends overseas or in other cities. certainly our job as an educator is actually to broach those subjects to the communities to say, hold on a minute, if you have sex, doesn't matter if you're married or unmarried, it's not protected, then you'll have STIs, or you'll get you're exposed to diseases. And when people travel and all that, we put it out there to the community to go, you can't, just because you're going to a different country and no one can see you doesn't mean that
you're not going to.
That's right. And then when you come back, it'll be the people around you, your wife and all that. So there are very difficult discussions that can emanate from people because of their social position. Because of the migration puts people in a more vulnerable position. Often women, I would say, are trapped by conservative social mores. I'll leave it at that.
This is a broad question, but how do you successfully promote a immunisation program to diverse communities?
You have to know which community. I think if you think that 1.5, what did the government use? Arm yourself for COVID-19. If you thought that was going to work through all communities, then I think you go back to first class of health promotion, You go every community, not even every, like we've done quite a number of messaging working with communities. And once you go in there and you try to interpret or translate messages, what you will find is one person will go, oh, this is really good. And the next person says, oh, no, I don't understand this. And the third person says, oh, really? No, that's against my beliefs. The take-home message is, so the more ways you can give the same message, and the more tracks, or what's the right word, the more multimedia ways you can give it, the better, because you're going to get the most people.
Yep.
So never think, I'll get one message.
Yeah, that's true. And the biggest carrot in terms of immunising the community in the last 10, 15 years has been the fact that parents are paid family allowance to get their children immunised. You wouldn't think that we should do that, but it's been the carrot that has meant that families will make it a priority. Mothers get busy with all their other kids to remember that, sort of this little one, it's 4 months, we have to get that one done, or 6 months or whatever. So life gets in the way. So the fact that they have been rewarded for taking the time to get them immunised, I think has been a bonus, even though it seems like you're punishing the ones that don't. They don't actually get Centrelink payments do come through, but they're held up until they get them done, which can be really challenging for families. So I don't think it happens as much anymore, because they know that if I get it done in a timely manner, the payments will continue. So that's been the carrot that has got us to these very high immunisation rates.
And if you think about it, I mean, this carrot actually works probably best with some of the more marginalised communities and people where, that bit of money is really, really important.
It is.
Obviously, for people who are wealthier, it's just not an issue. So in some ways, it does give the carrot to some of the more marginalised people who might not prioritise, because the priority might be putting food on the table or a house or whatever. But in the long term, it actually makes sense to everyone.
So I'm out in community asking people, what vaccines have you had and why is immunisation important to you? And here's what they said. Do you know what you're vaccinated for?
I'm vaccinated for COVID-19 and all the, like for flu, whooping cough, and all the hepatitis B vaccine and all the other vaccine that I was required to be vaccinated for.
Why do you think immunization is important?
It's important because everyone needs to be protected.
Do you know how to check what you're immunized for?
No, I don't know how I can check it. I would like to ask if you can give me the information have to check my immunization for all the vaccine I got. So I'm not sure which one I got before. It's long time. I cannot remember. Yeah.
Are you up to date on immunization?
不知道，
Don't
不了
know.
解。
Don't know.
Do you know how to find the information?
我是通常
I
到我的
usually go
家庭
to
医
my
生那里
GP.
And what vaccine did you get?
新冠疫苗
COVID-19 vaccine 3
接种了3
times
次，还有流感疫苗
and also flu.
Okay, we're back in the studio with our guests. When you ask people in the community what they think they've been immunised for, what do you expect them to say?
I suspect a lot of them won't know.
Yeah.
If they're from non-English background, they probably don't know that what the diseases are that they're being immunised against. They might remember things like hepatitis, measles, mumps, rubella. They probably don't know polio. They probably don't know. And when they say to you, "What is it that we're being immunised?" and you say to them, "These are the conditions that used to cause this, and this." They'll understand. Or if you say, "These are the diseases that used to kill so many children in the past and now they don't exist anymore," they understand that as a concept, but don't necessarily know that measles used to cause, a rash, pneumonia, those sort of things. They may not understand those. They just know that children used to die with them, but now they're protected. Don't be surprised if people say, "I don't know what I'm being immunised against," or what the child is being immunised against. I suspect that not many of them would understand it. And so then we're hoping that they totally trust us, that there's a benefit to doing these vaccinations.
And I think you've hit a very important point, is that sometimes people in the health sector or even health promoters, public health people like me, sort of want to give too much information, wants to make sure, "I know there's 10 points." When in reality, most people won't understand or have the time, and maybe just to know, you get vaccinated for A, B, and C, and you'll be better, or your baby won't get sick. That's all they got to know. If you get them over the line, that's all there is to know. So we always think, keep the message simple and keep it positive, and so where people understand. And so if you make it too complex, then you'll lose people.
I just checked my immunisation records in MyGov, and I was vaccinated, it turns out, for tetanus and measles when I was a child, and obviously I'm triple vaxxed for COVID as well. But I was expecting to be immunised against a lot. There's so many preventable diseases out
if you
there.
grew up in Australia, there should be a whole lot of vaccinations, and you're much younger, so you might have had a little immunisation book that you used to have once you basically, now it's a green book. It used to be
A yellow book. I've still got it.
Yep, you still. I had the cream one, the little one. That's how long ago it was. But basically, in there, things like your weight and your height and those sort of things should have been recorded, and all your immunisations should have been recorded. However, you might have to ask your mum if she's still got your immunisation.
Would that have crossed over to MyGov?
Not necessarily.
Okay.
You see, that it should have been, if you did indeed miss out those immunisations for a particular reason, it would be very unusual. A young person in Australia who grew up in Australia would have missed out that many. But if you did, for whatever reason, you can do catch-up vaccinations, and there's a process. What I'm showing you now is the current immunisation schedule, but there's a whole heap of ways to give catch-ups to different people, different at-risk groups. So we often find, for example, people who come from overseas, we were saying earlier on, who don't know exactly what they've had, and we try to establish what they've had, and then we establish a catch-up vaccination program for them to protect them, the same as other Australian citizens.
For people out there who don't know about their immunisation status, what's your advice?
I would say to them, go and see your GP or clinic nurse and sort of try to find out what information is in the AIR and that's been logged. Look for your green or yellow book or whatever you've got at home that has your vaccines whatever information you can get to bring in so we can work out what you need. And if we're not sure, then we can check what your antibody levels are for various infections and then recommend certain vaccinations.
I'd love to hear what you find most enjoyable about your work. So what experience made you decide to specialise in this area, or did you have a particular career trajectory that made you go into this?
I just came via hospital training into community health, and sounds really corny, but I fell in love with the community, and this is a sort of a general practice inside a community health setting, which I think is the best of both worlds, that we have access to all these health information supports. We've got access to allied health, dental. It's a really great place to work across a range of services, working with other people. That's mostly why I've stayed in this area.
Yeah, that wasn't corny at all. I don't mind a bit of corn, but that was appropriate level of corny.
Oh, look, for me, certainly not a career path or career choice. My first training was in botany. So I've got a Bachelor of Science going back many years. But then looking down a microscope at plant cells wasn't quite what really turned me on. So I just moved around and got into the community sector and just slowly developed a liking for this type of work. And look, it's really interesting because you learn new things. I mean, public health promotion is a huge area. And also you work with people, you talk to people, and you have some great discussions. Even if people go, oh, is that how you think? Right, let me, and you're always thinking, how can I give this message in a different way? How can I repackage that? What is going to work best? And as the years go by, new communities, new issues, new topics, it's never boring.
I'd like to wrap up with a final word for the podcast. So what's a final word you'd like to have for the community?
Don't be afraid, and don't be afraid to ask.
Oh, look, I think I would back that up as well. Yes, certainly we're there to answer questions that might arise. Just ask.
And if you're a healthcare provider and you want someone to feel comfortable,
spend time. Take the time.
Yeah.
Yep, I'll back that up too. Take the time and ask as well.
Exactly. If you don't ask, you won't know.
Thanks for coming in today. Really enjoyed it.
Yeah.
It's been a pleasure. Thanks very much.
Fun. Thank you.
Did you know that in Victoria, people under 20 years old are eligible for free immunisations? All refugee and humanitarian entrants, including asylum seekers, can also receive free immunisations. Some vaccines are available for purchase for those who are not eligible for free vaccine. But we do immunisation sessions here at NRCH on the first Wednesday of the month. So if you have any questions about immunising or you want to book for an immunisation session, just call NRCH on 9418 9800. That's all for the podcast today. I hope you learnt something. I know I did. I've got to ask Mum where my immunisation book is so I can get on top of that. But that's all for now. Thanks for listening and take care.